Good morning, everybody. Can I thank the more than 42,000 people who came forward for testing in the last 24 hours, but stress that we need those numbers to go higher. And when you see the fact that the numbers of cases are going up in the community substantially, we are extremely concerned that we need to turn the tide. To 8 p.m. last night, there were 44 cases of community transmission. Regrettably, 29 of those were either partially or fully exposed to the community. Now, that is the number that is really concerning us. We always, in New South Wales, aim to have zero community transmission. When we talk to you about the number of cases, we don't worry so much about the cases that are in isolation because we know that they're not spreading the virus. But when overnight you see a number like 29 who've been infectious for all of the time in the community or part of the time in the community, it tells us that in the next few days, those numbers are going to go up. It tells us that both the case numbers and, unfortunately, the number of people who may be exposed or have been exposed in the community is going to go up. This is the opposite of where we need or want the numbers to trend. I also wanted to spend a minute or so talking about the fact that New South Wales, and in fact no state or nation or any country on the planet, can live with the Delta variant when our vaccination rates are so low. So please do not think that the New South Wales government thinks we can live with this when our rate of vaccination is only at 9%. Because if we chose to live with this while the rates of vaccination is at 9%, we will see thousands and thousands of hospitalisations and death. Now, there have been modelling presented to National Cabinet and other bodies with the Alpha variant, which talks about this, but this is the Delta variant. And the difference between the situation New South Wales is in today and where we were a year ago is that this variant is far more contagious, far more transmissible, and the rate of infection, therefore, is going up exponentially every day. And when you only have 9% of your community vaccinated, opening up before you get as close to that zero number as possible means you would subject thousands and thousands to hospitalisation and death. In fact, Dr. Chant will say we have someone in their 20s on a ventilator currently in New South Wales. Now, I know we've done well in the last 18 months and we have had a degree of complacency, and now when we look around the world and we look at countries that are opening up, that are living freely with COVID and the Delta strain, they're able to do that because half of their population is vaccinated. We're nowhere near that yet. So until we get substantial rates of vaccination, we cannot afford to live with the virus. We have to quash it now. And we need to get as close to that zero number as possible before we open up. And when I say that zero number, the number of people that have been infectious in the community, last night it was 29. I suspect that will grow tomorrow and the day after, given if you've been infectious in the community and it's so transmissible, well, obviously we're going to see higher case numbers moving forward. So until we get to that zero or close to that zero, we cannot ease restrictions. In fact, based on the health advice the government received late last night and early this morning, New South Wales will be further tightening restrictions in those areas that already have stay-at-home orders. So previously we'd said up to 10 people can exercise outdoors. That is now 2 people. So it's 2 people. However, obviously households are okay. Parents and kids or carers and kids in the one household, whatever your household is, you can exercise together. But apart from that, it's only 2. And the other restriction on top of that is that you can only exercise within your local government area or within 10 kilometres of where you live. We don't want people travelling long distances exercising. So you exercise within 10 kilometres of where you live or within your local government area. Do not carpool. You're not allowed to carpool with anybody outside of your household when it comes to exercising, and we need to be very clear about that. I also want to stress again that the health orders will reflect, unless under exceptional circumstances or health reasons, one person from the household should go out shopping to buy essential items. Browsing is not allowed. Whether you're in a supermarket or whether you're anywhere else buying essential items, you have to think about before you leave the home, can I get this online? Do I need to leave the house to go shopping? And if I am leaving the house, you have to plan your visit. What do I need to get? And how can I get those essential items without coming into contact with a lot of people? Now, this next one is a heartbreaking restriction, but from Sunday, funerals will go back down to 10 people, because when you have the rate of transmission that we do in the community, we're now not only looking at areas where the transmission has occurred, but we're trying to prevent any what we call superseding events. We want to prevent any opportunity where someone with the virus turns up and spreads it to others. And so therefore, heartbreakingly from Sunday, funerals will only be able to be 10 people. With the other restrictions that I've mentioned already in relation to exercise, in relation to shopping for essential items, in relation to the distances and carpooling, that will commence from today at 5 o'clock. So please know that from today, those restrictions are in place. But for funerals, for obvious reasons, those going ahead tomorrow will continue, but from Sunday, and I apologise in advance to all those families going through such a difficult time. But unfortunately, we have no option. We have to take this action. And can I reiterate again, I know I repeat this message, and Dr. Chant and the Minister do almost every day. To alleviate any confusion, nobody is allowed into your house. Nobody outside your household is allowed into your house. The only exception is if you're receiving care by people, one person, dropping off essential goods, or for health reasons or exceptional circumstances. But nobody should be coming into your home, nobody outside of your household. And household means whoever lives there normally. And of course, the health orders have exceptions to that. But the basic message is there is no limit. There is no number now that says you can have a certain number into your house. The number is nobody apart from what is defined as your household can come into your house. Now, I appreciate the message I'm delivering today is quite shocking for a lot of people, but I need everybody to be shocked, because when I said just a few days before we had to go into lockdown that this was the scariest period for New South Wales during the pandemic, unfortunately those words are absolutely the case. New South Wales is facing the biggest challenge we have faced since the pandemic started, and I don't say that lightly. I don't say that lightly, and unless there is a dramatic change, unless there's a dramatic turnaround in the numbers, I can't see how we'd be in a position to ease restrictions by next Friday. And that is why all of us need to work together. All of us have responsibilities. Dr. Chant will say today, the suburbs now that are of concern, yes, there's a predominance of cases in southwestern Sydney, but we're also seeing cases pop up in other parts of Sydney, and that is a real concern. The message is do not leave your home, do not leave your home unless you absolutely have to. That is what a lockdown is. But we're providing these other opportunities because we know that after 18 months, we're all fatigued, people are stressed, and we appreciate that people will need, for their own mental health, to exercise, for their own mental health, make sure they can get the supplies from themselves, or somebody who is isolated or ill and can't get those supplies, or the most vulnerable. And we want to make sure the most vulnerable are protected. But don't use the rules we have in place as a way to work around the rules. The basic message is do not leave your home unless you absolutely have to. And New South Wales Government, as I said, always takes the health advice. We always look at the science and the facts. But I want to stress that this Delta variant is far more contagious than any part of the virus we've seen. It's far more transmissible. It's transmitting in different ways. And the health data that we're seeing says that if we open up before we get as close to that zero as possible, and again, I'm not necessarily talking cases, but we need to have 0 people who've been infectious in the community, because that tells us there still could be undetected strains of community transmission. So the figure to be really mindful of overnight is that 29. So imagine that yesterday and the last few days, we had 29 people with the virus in the community in some way. And we can't see that continue. It's up to all of us. And don't think that because you don't live in a particular part of Greater Sydney or the greater metropolitan area that's currently in lockdown, that your area won't get this or that you're safe. Please assume that every time you leave your home, you are at risk of getting the virus and bringing it home to your family. You are at risk of spreading the virus to those closest to you. And I can't speak more strenuously than that. I've always taken pride that the New South Wales government is honest and upfront with our citizens, and I'm being as direct as I can given the information we have. And I appreciate it's a concerning time for all of us. This is not the time for complacency, not the time to cut corners. Compliance is so important. Compliance means sticking to the rules at all times. Don't use the rules, the exceptions we have in place to think that that's how we can live. The strongest message is do not leave your home unless you absolutely have to. I'll let Dr. Chant now give her update and then we'll take questions.
Thank you, Premier. So there were 44 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 35 of these are linked to known case or cluster, and 10 are close contacts and 25 are household contacts. Now, this fact re-emphasises that it is your closest friends and relatives who you will put at risk if you visit them. And also this level of household transmission highlights the fact that we need you to get tested. So if you've got the most minimal of symptoms, please get tested so we can detect it early and prevent as much as possible further transmission within those household settings. We've had one new case that was acquired overseas. I just want to also echo the Premier's comments. I know that this has been, it's been a long journey in the fight against COVID, but we cannot stumble over this hurdle. This is incredibly challenging times, and I just want to stress that I am incredibly concerned. I need all members of the community to follow the public health advice. And at the times when we had the lockdown in March, people were seeing images from overseas, which sort of reinforced the fear and concern about COVID. And now people are looking at countries overseas where they're seeing people go about their work and pleasure in a sort of semi-normal way. And I think that is really important to highlight. That's because those countries have got vaccination coverages for their adult population, and in some cases down in the childhood population, that is very different from our situation. We have only got 9% vaccination coverage. We cannot let this virus take further foothold and lead to an exponential rise in cases. It will have significant impacts in terms of health and well-being of our community. I would also just like to emphasise that we have currently got 43 people in hospital due to COVID, 10 people in ICU, 4 of whom are ventilated, and we urge the community to follow the stay-at-home rules and the public health advice to protect themselves. 14 people, sorry, I've just got something in my eye and I shouldn't be using my mask for that, but sorry. If I could just get a tissue, and apologies for that. There are 14 people that are admitted to hospital at the moment with COVID. Thank you. Sorry. Apologies, everyone. Sorry, something was in my eye then, apologies. We've got 14 people admitted to hospital at the moment with COVID under the age of 55, and of those, 7 are under the age of 35. Now, I'm just going to read this next piece very slowly. Of the 10 people in ICU, 1 is in their 20s, 1 is in their 30s, 1 is in their 50s, and 5 are in their 60s, and 2 are in their 70s. This trend has to be turned around, and the only way we can do so is by seeing a decline in numbers. COVID cannot affect people if you do not come in contact with them. And therefore, that is the basis of the stay-at-home orders. Stay with your household, get tested. As soon as you have the most minimal of symptoms, get tested. So I'm going to read out the suburbs of concern across Sydney. And the reason I'm reading out these cases, and this reflects intelligence overnight about where we're seeing emerging cases. Some of these cases may not have been announced, but we're trying to update the community in real time about the areas that we've seen cases emerge, where we don't have a clear link, that they're not a household contact, and even before those investigations of those linkages are done, so the community has the most up-to-date information. So people in Sydney's southeast, Sutherland, Kareela, Sylvania, Hurstville and Maroubra need to stay particularly vigilant and continue coming forward for testing and share important health messages and follow the health advice. And the other suburbs where we're seeing a number of cases is in the Bosley Park, Smithfield, Fairfield, Glenfield, West Hoxton, Bass Hill, Greenacre, St John's Park, Bonnyrigg Heights, Panania, Bankstown, Canley Vale, Carramar, Casula, Chester Hill, Adenza Park, Edmondson Park, Greenfield Park, Moorebank, Narellan Vale and St John's Park. In relation to our media release today, we've highlighted where of the 44 locally acquired cases reported to last night, 21 are from southwestern Sydney, 8 are from southeastern Sydney and 7 from Western Sydney. So my calling out the suburbs really reflects the intelligence on where we've had cases that are infectious in the community. But that doesn't mean that if you've been anywhere else that you can be complacent. Every time you leave your home, you need to assume that you're coming into contact with someone who could potentially have COVID. So even when you're out and about, make sure your masks are covering your nose and mouth, that you're using your hand sanitizer, you're keeping the distance, and checking in with the QR codes. I'd also like to just give you an illustrative example of why we really need people to stop moving about. So at the moment, we have over 14,000 close contacts. Now, yesterday, it was 7,000. Now, the reason is that we've had a number of large venues, and I would, in terms of people being out and about, and obviously, there are needs that people have for essential groceries. People might need to get bedding, heaters, blankets, a broken fridge. These are things that are essential. But what I'm asking you to do is every time you have set foot out of the house, make sure you ask you these following questions. Can you do it online? Can you do click and collect? And if so, or if you need to go to the store to collect the item and it is essential, can you make sure that you stay there for the most minimum period? In the orders, and even the previous order that will be the order coming into effect and the previous order, browsing was not permitted under the order. So we do not want you to go out of the house, and you're very clear for the purpose and intent of why you're going out of the house. And in relation to those venues of concerns, one new case is linked to IKEA at Tempe on the 6th of July. So anyone who attended IKEA Tempe on the 6th of July from 10 a.m. to 9 p.m. is a close contact and must immediately get tested and isolate for 14 days, regardless of the result, and call 1-800-943-553 unless they've already been contacted by New South Wales Health. Anyone who's also been at these other venues are also a close contact and must immediately get tested and isolate for 14 days. Sadaquat Supermarket in Marylands, the Post Office at Marylands, these are on the 5th of July, and in relation to the supermarket, it's from 1:30 to 2 p.m, and in relation to the post office, it's 2 p.m. to 3 p.m. Aldi at Marylands on Monday the 5th of July from 1:30 p.m. to 3:30 p.m, and Kmart Marylands from Monday the 5th of July from 1:30 p.m. to 3:30 p.m, and Auburn Fresh City Vegetables from Monday the 5th of July from 3:30 p.m. to 4:30 p.m, and again the Saha, S-A-H-A market in Auburn from the 5th of July from 3:30 to 4:30 p.m. Thank you.
May I ask, this is obviously a worsening situation. We've had lockdown and it's not getting any better. Have we lost control of the Delta variant, and do we now need to see all retail except for those major department stores closed?
I'm sorry, I didn't get the end bit of the question.
Do we need to see all retail except for those major department stores closed?
What we need is for everybody to follow the rules that are in place. The biggest challenge we have is lack of compliance, and that might be because people are complacent and don't think this is serious, because previous types of the virus, previous strains of the virus have acted differently. So what all of us have to understand is this strain, called the Delta strain, is more contagious than anything we've seen and is transmitting in different ways. So the issue is that all of us need to be aware, and our challenge is making sure people understand the rules. The vast majority of people want to follow the rules. Our challenge is to make sure people understand what the rules are in place, but also to follow those rules, those settings. We're pretty clear. I don't know how much clearer we need to be. Please do not leave your house, do not leave your home unless you absolutely have to. Those exceptions that we've given are literally exceptions. Most of us should be spending most of our time within our household, unless there are those exceptional circumstances otherwise. And I just need everybody to appreciate what a serious situation this is. The difference to this strain and other countries responding to this strain are that we have a very low level of vaccination in New South Wales. It's only 9%. We do not have the option of living with this. We have to quash the community transmission, because if we don't, we will see thousands and thousands of people in hospital and lots of people, thousands of people potentially dying. Until we get those vaccination rates, higher, we do not have the luxury of considering living with this virus. We don't have that as an option.
Are you disappointed? You couldn't be clearer, but we're 2 weeks into a lockdown, and it's only now that we're actually seeing a full cohort of lockdown restrictions. Why didn't you implement them at the start?
Well, firstly, we have to follow the health advice, and health relies on the data. And what we need to appreciate is, as soon as anybody has symptoms, they must get tested and stay home and wait for the advice. So we must follow the health advice. We must ensure that the settings we have in the community at any time, bring the community with us. We are 18 months into the pandemic. Some people will say we've gone too hard. Some people will say we've gone too soft. But the reality is, every action we ask the community to take, every update we provide is based on the best health advice at that time. And unfortunately, whether it's complacency or whether it's compliance, we've seen too many people out in the community with symptoms, too many people who've continued to go to work, essential work, too many people who've either misunderstood the rules or not followed them, and that has to stop. Therefore, the strongest way we can tell everybody to act, the strongest way is to say, do not leave your home, your household, unless you absolutely have to. That is the basic rule that everybody should be following. Those exceptions are there to support people during this difficult time, to support people in having to undertake necessary business, having to undertake necessary care, or mental health and exercise. But please know that the strongest rule everybody has to follow is do not leave your home unless you absolutely have to, and our health advice is always based on the best available statistics and data, and the New South Wales government always has and always will follow the health advice. We also have to appreciate that we need to bring all of the community with us, and everybody in the community has a role to play. Each of us have a role to play in making sure that we understand what the rules are. I'm concerned that too many people that are currently subject to stay-at-home orders haven't been appreciating what they need to do. We're still getting questions through Service New South Wales about how many people you can have into your home. The answer is 0. Unless you're providing essential care, as in dropping off goods or services to an isolated person or someone who can't fend for themselves or take care of themselves. That is 0, but we're still getting people asking us that question. So I just say to everybody, please be alert, be aware of the rules, and please know I don't mean these words lightly or say these words lightly, but we are facing the greatest threat that we have faced in New South Wales since the pandemic started, and it's up to all of us to turn things around, because at the moment the numbers are not heading in the right direction, but we do have the ability to do that. We are still in a zone where we can change things as a community if we all work together, and I want all of us to have that aim, to have that goal, that by changing our actions or by providing information to friends or family who may not have the opportunity to listen to our conferences or to get the information, all of us have a role to play, even in our own social circles, through virtual means, through phone calls. Make sure those in and around us have the information they need to comply with the rules, because compliance is our biggest challenge. It's not so much the settings, it's the compliance. And the reason why we've gone a step further today is not only to mitigate against some of the areas or venues in which people are transferring the disease, but also to send a strong message to people that leaving your home is the exception. Leaving your home is something you should only do if you absolutely have to.
What's your best advice on how long it's going to take us to get to 0 cases?
The best advice on what it will take us to 0 community transmissions is up to all of us.
The duration. Your best advice for how long it's
Right.
going to take us.
I can't give that answer today, because it will depend on how the community responds to all the restrictions and how the community responds to the situation we have now. So it's really up to us as to how long we are in this situation for. But what I can say is that our target has to be 0 or close to 0 community transmissions before we can live a normal life that we did prior to the lockdown. And that is because of how contagious this is, and that is because our vaccination rates are only at 9%.
You anticipate home schooling to last for longer now, and also what's to go with childcare centres? Are they going to stay open?
Yeah,
and
look,
why can they stay open?
Yeah, the current arrangements around childcare centres and the like will stay in place. But I can't really comment on what school might look like until we get more information and more data on where the numbers are heading. But it's my job to be as direct and as upfront as I can be, given what we know today. And I just want to get rid of any speculation about us living with this variant. We cannot live with this variant. No place on earth has it, and no place on earth has, unless they have their vaccination rates much, much higher than what we do, because otherwise it subjects the population to thousands of hospitalisations, thousands of deaths. And I know that we're a bit complacent. There's a lot of commentators who argue it's not a serious disease. It is a horrible disease. It affects people of all ages, and this variant is, as Dr. Chant said, she read out the number of people in intensive care and their ages for a reason. Young people are having to be admitted into intensive care, as well as older Australians. And we have to be aware of that. We can't be complacent. And again, if we see images overseas of some countries living with this, it's only because their vaccination rates are at least around 50% of the population or higher. Well, we're nowhere near that.
Are you disappointed, though, on that basis, that there appears to be some members of your own cabinet that think we should be letting this rip?
Oh, look, everybody's entitled to their view. My job is to speak to the facts and to speak to what New South Wales has to do. And I appreciate there'll be many in the community that think we've gone too far. Some will think we haven't gone far enough. But what we need to do is rely on the health advice. And the health advice is based on the most recent data we have. And I just urge everybody to get out of your head, please acknowledge we cannot live with this whilst the vaccination rate is only at 9%. It is not possible, and I don't think anybody in my position would subject thousands and thousands of people to hospitalisation or death. And I should also say, equally, the economic impact will be devastating, because if you think you can live with this and it goes wild in the community, nobody will be going to a restaurant or a bar when there's thousands and thousands of cases, thousands and thousands of deaths. Nobody's going to want to leave their home. So I want to stress that the economic impact of trying to live with this is as severe as the health impact. And we know that businesses would much prefer, and that is the feedback to us, businesses would much prefer we stayed in lockdown until we need to, so that we can have confidence that once we come out of lockdown, not only can we be assured of our health safety, but also be assured of economic and business continuity. So our response is as much based on our economic position as well as the health and safety. Health and safety is always obviously top of mind, because if you don't address the health and safety, you cannot address the economic consequences. But we understand and appreciate the economic consequences, but the feedback from the vast majority of business leaders, small, medium and large, is they would much rather we get out of this with zero community transmission, live as normally as we can until higher rates of vaccination are here. And this is part of the roadmap in New South Wales. Sorry, just someone who hasn't asked a question yet.
On hospitals.
I'll come back, yeah.
On hospitals. Are we preparing more ICU units? What's the capacity there? And secondly, visiting is restricted to extenuating circumstances at the moment. That's causing some grief naturally. Can you explain what those extenuating circumstances
Yes, certainly.
might be?
I'll ask Dr. Chant to comment on what visitation can happen in hospital, but please know that at the beginning of the pandemic, New South Wales quadrupled its capacity to hospitalise people who might need ICU or need to be in hospital because of COVID. So the capacity is there, but I don't want us to have to go to that. I don't want to subject thousands of people to that scenario. It is not a pretty picture. In relation to visitations at health hospitals and other health facilities, I will ask Dr. Chant to comment on that, and then I will take, don't worry, we're going to get through all the questions today, but I will give priority to those who haven't asked one yet.
Thank you. So early on in the outbreak, we protect vulnerable settings, and obviously healthcare and aged care are particularly vulnerable, and also disability care homes. Extenuating circumstances obviously need to be considered, but for instance, end-of-life care, so that, for instance, seeing a loved one who is at the end stages. There may be other extenuating circumstances about a birth or and also for young children. So there are a range of things, and our healthcare services hopefully show, and I know they do, show compassion. But we're also asking people to really think about, do they actually need to go? Is that an extenuating circumstance? In those circumstances, we often put in added protections in terms of clearly anyone who would be visiting would be wearing masks. We would make sure they're extensively screened. We would make sure hand hygiene had been administered. So it is critical that we protect those healthcare facilities, because we have the most vulnerable in our aged care and our healthcare settings.
Dr. Chant, can I ask you of the cases, the new cases, do we know how many are vaccinated?
We're actually just collating that information, and we will be putting all of that in our epidemiological report, because we know that even throughout this you'll want to collect that. So we are just collating that, and we will be releasing
How many
that.
then of the total cases that, can I just go through this, how many of the total cases
I
are
haven't
vaccinated?
got that information. We are just cross-checking the immunisation records of the cases to make sure.
And the 40 in hospital, we don't know that either?
We have pulled that together, and I expect that we could have that by tomorrow. We're just looking at how we can routinely report that information.
Shouldn't that be known by now, though, Dr. Chant? Isn't that crucial information?
It is crucial information, but we don't need to rely on our own local information. What we need to know is that people with the vaccine, we've got large-scale international studies that show, in the presence of the Delta strain, if you've had 2 doses of the AstraZeneca vaccine or 2 doses of the Pfizer vaccine, it affords you good protection against serious hospitalisation and death. And that is my key message. If you have had your first dose of AstraZeneca please go and get your second. If you haven't had any doses, check the eligibility checker and see if you're eligible, and please go and have that discussion with your doctor about getting a vaccine.
Dr. Chant, with the testing rates being quite a bit lower, one of the biggest deterrents for people is that they have to isolate until they get their test results, which can take anywhere between a day or two, which would be a huge deterrent for people that can't work shifts and those sorts of things. Would you consider, like you did with the Bondi Westfield, making it so you don't have to isolate until you get your test results, so at least we get a better idea of how far the virus has spread?
So there's two factors. It's really pleasing to know that we've got such good laboratory capacity, but it still is a finite capacity. And it is also important that we reach the highest groups in that testing, because we don't want to overwhelm it with a large number of tests from people that have a low probability of having the disease. And so that's why we balance those factors. Clearly, anyone with symptoms, however mild, gives us the best likelihood that they could have COVID, and so those. And obviously making sure that we've messaged to anyone who's been at our venues or in contact or proximity with infectious cases. That's why it is important that you go to the website, you follow the health advice, because we've put up a number of venues, and obviously we're reaching out to a large number of people that have been in those settings when there's been infectious cases walking around. Now, those infectious cases will have been wearing masks, but again, we know that people don't wear masks accurately, and there can be risks, and masks are not perfect. They provide some protection, but they're not absolute. So we do ask everyone to go to the website, look at whether you're impacted by those venues of concern, and really keep monitoring those, and with the most minimum of symptoms, get tested.
Dr. Chant, from a practical point of view, tomorrow's a Saturday, it's obviously a huge day with auctions, people moving and so forth. Will auctions still go ahead, open for inspections, and can people actually move houses on a Saturday and have family help them?
No, so they can't have family help them.
Can they still move?
We will clarify the issues with the orders, but that's a really good point. At the moment, we don't want to see, the principle we want to achieve is that no, you do not mix with anyone outside your household. We really need to stop our interactions with others at this time, and that's the basis of the health orders. Can I just also reflect that the previous health order before the strengthening today had no browsing, only essential shopping. And so partly this is a partnership with the community, the business, where what we're trying to do is convey our concern, the level of concern we have, and we're hoping that the community, as they have done so brilliantly before, responds to that and changes their behaviour. And that is the purpose for all the information we release, is really to highlight the risk to the community and ask the community to come on this journey.
So would auctions and open for inspections happen? Because I know that was listed previously last year, there were restrictions.
I'll look at, I'm sorry, I'm not aware of that minutiae, but I'm certainly, the principle I'd like to do, and we'll have the discussion, is that they should be actually moving online, and there should not be any groups of the auctions houses.
Premier.
The conclusion that I really want to get to, and is there anything else we can do to encourage or get people tested in areas that really need to be?
So we're working with can I just say, our testing capacity now is much better than it's ever been. So we do need to use that tool to assist us and find any unrecognised cases. We are working with the private, so even today we're having another discussion with the privates to look at what other models we can do, what are the barriers that people are encountering. Again, a couple of things that come up. If you're frail and elderly, you'll go to the front of the queue. So don't worry about the fact that you think you might have to wait. Most of the testing sites have ability to bring you forward in the queue. Certainly there are also some options in some cases where we can get testing in the home. And we're also looking at particular sites where bringing testing more to sites might be a really good way of getting that testing levels. I think it's really critical at this time that we maintain those testing levels well above 40,000 every day, but I also want to see people not delay getting testing. One of the issues that's come up is people sometimes are really, having a COVID diagnosis is to some very bad. It's as if they've done something wrong. Can I just say, you haven't done anything wrong in acquiring COVID. in most cases. But the point I'm trying to convey is that it's important that you actually don't put your head in the sand and think, if I just stay at home, I'm okay. I don't really want to know. I'll get better. The reason for that is knowing your diagnosis that you've got COVID means that we in New South Wales Health can provide better care. If we know what diagnosis you've got and your condition deteriorates, we know how to treat you and how to respond to you. And also, which is probably even more important to you, you may have exposed other people. And again, the last thing you want to do is have them not recognise that and then potentially they expose others. And so please do not ignore the signs and symptoms. Please get tested and ensure that you follow the health advice.
Deputy Commissioner, may I ask you a question?
Of the level of policing in South West Sydney compared to what we saw in the east. Do you want to address why you've gone down that path? What are police authorised to do? Can they look in people's bags and say that shopping's not essential?
Firstly, I'll ask Deputy Commissioner Worboy to respond to this point as well, but it's an important point. The police and our regulators move where the virus is moving. So whether it's the Northern Beaches, whether it's southeastern Sydney, whether it's southwestern Sydney, and now we've seen suburbs closer to the Shire, police will move where the virus is moving. And we know from the get-go that compliance is our biggest challenge. And we appreciate it's always a fine balance, but we need to stop people doing the wrong thing no matter where they live, whether it's in my suburb, whether it's in any part of Sydney or Greater Sydney or anywhere else which is subject to the stay-at-home orders. But I want to make that point very, very clear. The police, our regulators and the focus always moves to where the virus is moving, and it doesn't matter what that postcode is and it doesn't matter what the situation is, but the police move where the virus moves to. And I participated in many community discussions yesterday and the day before, as did Minister Hazzard, to assure the community the police and our regulators are there to help and there to keep everybody safe. And the previous question that was asked about how long will it take to zero, that's up to all of us. And unfortunately, on many occasions, people don't do the right thing because they don't understand what the rules are or how serious the situation is. But I will ask Deputy Commissioner Worboy to also add to that question.
Well, thank you, Premier. Minister, Dr. Chant, good morning. Commissioner Fuller made an operational decision to push more police into southwest Sydney. That was made similar to when we put police down on the border down on the Murray River. Similar decision was made where we pushed police into Bondi recently around the beach area. A similar decision was made not that long ago in the Northern Beaches when that area was locked down. The operational decision is based on the public health orders and the fundamental response that police have to enforce those health orders. But people need to be very clear that right throughout this pandemic, and indeed in the last 2 weeks or so, particularly in southwest Sydney, the vast majority of people do the right thing, absolutely have done the right thing. So what we're asking is for that community, all communities across New South Wales, to work with police, to understand their responsibilities, to share that responsibility. And particularly in southwest Sydney, where there might be some barriers to what people can and can't do, we would really ask family and friends to explain it to those people what's required of them. We also have a team of multicultural police and liaison officers that will work with our police commands in southwest Sydney. We know it is a very difficult time, but the issuing of a notice or getting in a confrontation with police is the very last thing that we want. We want people to take the responsibility, share the responsibility, and what we know is that at this moment it is a crucial time for the community, the police and health to work together.
Deputy Commissioner, sorry.
Just last weekend, the warm weather brought out tons of people to beaches, parks. It's pretty miserable weather this weekend. Are you hoping that that keeps people inside and stops the virus from transmitting?
Well, I think the message about this weekend and potential rain is that indoor settings are where the virus transmits more readily. So do not use grocery shopping as your outdoor event. You have to stay home unless you absolutely need to. And today we formalised reducing the number of people that can exercise together down to 2, unless, of course, it's the household. So if it's parents and kids or whomever lives in the household, flatmates, they can exercise together because they essentially live together. But aside from that, it's only 2. And we do want people to be outdoors where they can if they do need that break. It's a safer environment than indoor settings. Do not browse, do not go to an indoor setting because you're bored and it's a rainy weekend. That is how the virus spreads. Only leave home when you absolutely have to. And in fact, indoor settings, whether it's a household, whether it's a supermarket, are more likely to spread the virus than exercising outdoors. But the reason why we're clamping down on even that is to send the very strong message that we don't want any unnecessary contact outside of your existing household, and we don't want people moving around. We want people to stay at home unless they absolutely have to.
Deputy Premier, how close are the mass vaccination hubs from being ready? You spoke about the need for vaccination rates. And do they need to be fast-tracked given the news about the Pfizer vaccine?
Oh, we need the vaccine. We have more than 100 New South Wales health sites. We have many GP practices. What we need are the doses, and that is what we need. As we announced, we will have a mass vaccination hub in the Hunter, in the southwest of Sydney, Macquarie Fields. We already have one at Olympic Park, in addition to the hospital sites and 100 sites across New South Wales. We're also obviously engaging with pharmacists to increase what they're doing. What we need now are doses, but please make sure you get the second dose of AstraZeneca. Make sure you get AstraZeneca where you can. But of course, any doses of any vaccine are welcome in New South Wales, and that's the challenge. We only have 9% of our population vaccinated.
So how close are they? So how close are they from being ready? Will they be ready by the time August comes?
We have capacity now through New South Wales Health to do hundreds of thousands of vaccinations every week. The GPs have capacity. We need to get more GPs on board, but GPs have capacity to do lots and lots of vaccines. Pharmacies have capacity. What we're missing at the moment is the doses, and we know they're coming. They're coming mid to late September is in terms of the large-scale supply. But until that time, we have to be conscious that we will have low rates of vaccination.
Premier, one.
Sorry.
Prime Minister's announced yesterday talking about rules around the disaster payments. Going to help a handful of people, but people outside of Greater Sydney, tourism industry casuals have all been put off. They're going to get nothing. What more can you do for them and for businesses as well that are really...
Yeah, please know that the Treasurer, the State Treasurer, Dominic Perrottet, myself, the Prime Minister and the Federal Treasurer are in ongoing discussions. The Federal Government accepts that they will provide support to New South Wales, which we're grateful for. Those conversations are ongoing. And of course, given the situation we're in, we are considering all options in how we can provide greater support. Interestingly, when we provided business support to New South Wales, we didn't just focus on those areas where there's lockdowns. We actually focused on all of New South Wales because we know that businesses in the regions who haven't had the tourists come during the holidays are hurting almost as much as those subject to the stay-at-home orders. So please expect us to say something positive about that. I don't want people to stress about their financial position. Please know that we're working hard on what extra measures we might provide to support businesses, but also households, because households will be doing it tough. And I look forward to saying something about that in the next few days.
Premier, may I ask?
So who hasn't asked? Is there anyone who hasn't asked a question? So can I just ask, has anyone not asked a question? Everyone's covered, okay, yeah.
On that roadmap, you talked about in the coming days releasing that roadmap. Are you going to delay that now? How are we going to come out of these restrictions given...
Yeah, I mean, I think what the public need from us as a government is certainty. And so when we get closer to that zero community rate of transmission, we will definitely be providing a roadmap on what day one outside the lockdown looks like, what 2 weeks after the lockdown looks like, and beyond that. We know that certainty is important, but the best certainty we have is that we will get out of the lockdown quickly and more efficiently the stronger we work together.
Premier,
each of us have a responsibility. It doesn't matter what suburb we live in, doesn't matter what our circumstances. All of us should accept that we shouldn't leave the house or have anybody come into our house unless it's very, very exceptional circumstances.
Premier, one of the issues that is certainly gathering speed online, there are upset people in the community about it, is the Rachets owner. I know it's a small-scale issue, but it seems to be gaining momentum. Were police too heavy-handed on that arrest? And do you admit in some ways that people do feel targeted out in the southwest, that they do feel like they're being treated differently to other people?
Please, no, I don't want anyone to feel like that. But what you should feel is if you're not doing the right thing, please know that we will have to have the law come down on you, because the simple fact is people doing the wrong thing means all of us suffer. And we know that many people acquire the disease quite unknowingly to them. They may be in the community unknowingly to them, and we don't want anyone in that situation to feel guilty. But if you're knowingly doing the wrong thing, you're hurting those closest to you and you're hurting all of us. So I do expect the law and compliance to make sure that people are doing the right thing. If we don't have those measures in place and people think they can cut corners, we won't get out of this in a timely way that all of us are hoping. And that's why it's really important.
Premier Southwest Sydney community leaders have stressed that one of the challenges with the messaging is cultural and language differences. How will a large high police presence change that?
Well, there's a multiple things that we're doing in all communities to make sure people firstly feel they understand their health orders and also the risks. It doesn't matter where you live, and whether it's different communities, elderly communities who have had specific messaging for, specific industries and workplaces we've had specific messaging for, people whose second language is English. There are lots of different parts of the community that we've had specific targeting messages for. I don't want anyone anywhere in New South Wales to feel that they're being somehow singled out. All of us are in the same situation. If you're doing the wrong thing, no matter where you live, it's a problem. But what is also a challenge for us is making sure everybody gets information on what they should be doing, and the most simple, if there's one message I want people to take out of today, do not leave your home unless you absolutely have to. And that is the bottom line.
You haven't defined as essential businesses. It's obvious from the information today that the person who was at the IKEA was a staff member who's been there for 11 hours. Aren't you, by not defining what's essential, forcing people to go to work? And that's exposing large numbers of people.
I think people understand what is required when it comes to that. And we also don't want people unintentionally suffering if they can't access something they really need. But the basic message is, do not leave your house unless you absolutely have to. And as Dr. Chant said, browsing, killing time is not a good enough reason to leave your house. Getting an essential item, a baby product, getting bedding or heating, if you can, do it online, do it virtually. There's no doubt about that's our preference. But we also have to appreciate that we don't want to cause unnecessary anguish and hurt and suffering to people already doing it tough. But we can't be stronger than saying, do not leave the house unless you absolutely have to. And that's why we do have to have a presence of compliance. We do need to make sure people are doing the right thing. Refusing to wear a mask in a particular setting, refusing to follow any of the health orders in a particular setting is a risk to all of us and is an equal risk across the board, and we can't have that continue.
We know that lots of people during the lockdown may have reconsidered the risk of AstraZeneca, particularly a lot of young people, and they may decide to go and have that conversation with their GP. There are stories of people in regional New South Wales that don't have a GP in their area that is willing to give AstraZeneca because they're saying the risks are too high. There are also people in those regional communities who have had their first AstraZeneca jab and the only doctor in town is not administering the second.
Well, that's why the New South Wales government is engaging very closely with pharmacists as a possible way in which we can get the AstraZeneca vaccine out. So we are looking at those opportunities. Please know that even though we don't talk about everything here necessarily, we are working hard behind the scenes to make sure that where we do have, of course, we do have supply of AstraZeneca. And I do want to encourage absolutely everybody over 60, obviously there's about 2 million people in that category. If you're over 60 and haven't had the AstraZeneca, make sure you get it. If you're under that age and want it, please contact a GP. In the future, you may be able to go to a pharmacy, and we're working on that. And we'll let you know when that's possible.
Can you confirm whether,
for
people whether visiting partners who you don't live with is still acceptable?
Yeah, I'll ask Dr. Chant to convey, but that my understanding is that hasn't changed. Is that right? Yeah.
We've made very clear. We've made very clear that we don't want people to leave their homes. We don't want people, unless it's for the essential reasons that we've talked about. But we've also made clear that what we're doing is trying to strike the balance of compassion and common sense. And so if you have a partner who doesn't live with you, then obviously your intimate partner can attend with you. Can I just say, there was a question asked earlier about real estate and auctions. Regrettably, I have to be a little more across some of these orders than others. The well, she's not into auctions, keeping her safe. But can I just tell you that the current arrangements in Greater Sydney are there are no open houses for real estate. There are no auctions in the physical sense. They can be online. If you want to see a house, because obviously people need to not end up homeless, then you can book an appointment with your real estate agent. And you can obviously move houses, otherwise you'd have people homeless. But common sense. Can I just say this too? I mean, I can't tell you how concerned I am now as Health Minister the way this Delta virus is moving through our community. We were told some years ago by former Prime Minister Howard, I think it was, to be alert and not alarmed. Right now, here in Greater Sydney as Health Minister, I am both alert and alarmed. I have seen the figures of people who are out and about in the community. I've seen what health is concerned about, and I share that concern. We must stress to each individual we have the responsibility to stop the virus in its tracks. The only way we can do that is to not leave our homes unless we absolutely have to, and don't visit our family, don't visit our friends, keep them safe. That's the one thing that is in everybody's power.